Good evening and welcome. Alan Slaughterzinski here for Space Coast Daily Health Spotlight, and I am once again back at the Florida Pain Institute. And today I'm at a location I haven't yet visited. I'm in the downtown Melbourne location, located here on East New Haven Avenue. There are 5 other locations that service the Brevard County area of Florida Pain. Let me just tell you that there is one central number for all of them. I'll give that to you here in just a second. Those locations include Merritt Island, Vieira, Pineda, Palm Bay, downtown Melbourne, and Florida Pain Services, the Titusville area. That centralized number is 321 784 8211. You can also check them out online at floridapaininstitute.net. And it is my pleasure today to welcome back to our Health Spotlight Roundtable here Dr. Kamal Fatou. Dr. Fatou, welcome back.
Thank you.
And we've got a newcomer here with us this evening. She is a nurse practitioner here at Florida Pain. Her name is Nicole Malerba. Nicole, how are you?
Good, how are you?
It's great to, thank you, good. It's great to have both of you here this evening. Dr. Fatou, it's been a couple of weeks since we last met with you, since you've met with our viewers. Since there probably are quite a few that maybe haven't seen that or met you yet, would you tell us a little bit about yourself?
Oh, sure. My name is Dr. Fatou, Kamal Fatou. I moved here about a year and a half ago from the University of Kansas in Kansas City. But I've worked in several locations before that. I did training at multiple locations around the country and even in another country. So I trained in England for about 8 months. I trained in Michigan for about a year and a half. I trained in New Jersey for about 3 months during my medical school training. And then I did my internship in Michigan as well, in the Detroit area. I completed residency at Thomas Jefferson University in Philadelphia. I was there for 3 years where I served as chief resident. And then I completed training at Memorial Sloan Kettering Cancer Center in New York City, where I was blessed to be taught under some of the greatest pain physicians in the country, if not the world. And I was able to take that type of training and really focus it in on bringing great quality care for my patients that have cancer and patients that don't have cancer. And so I really pride myself in helping those cancer patients because they need our help.
One day when we have a little bit more time, we'll get Dr. Fatou to tell us about when he worked in the prison system. Quite an interesting story there. And sitting next to Dr. Fatou this evening is nurse practitioner here for Florida Pain Institute, and her name is Nicole Malerba. Nicole, good evening, welcome, and tell us a little bit about yourself.
So again, my name is Nicole Malerba, nurse practitioner here at Florida Pain Institute. I work directly with Dr. Fatou. I did my undergraduate training at University of Central Florida and my graduate training at Florida Atlantic University. My first job was in primary care, so I got a vast variety of exposure there. I did a little bit of acute and chronic conditions, women's health, dermatology, and just a good variety. So now I'm in pain and I love it.
Go Knights, right? National champions. There you go.
Yes.
Dr. Fatou, all right, let's start off the questioning with you this evening. Florida Pain Institute and their great locations. Again, the number 321-784-8211 is centralized number for all of the locations. Florida Pain, the best in the area. But what is it that makes the Florida Pain Institute the experts in pain relief?
Very good, precise question. I think, that we have, one, obviously, several locations, as you mentioned, which makes it very convenient for our patients to be able to be seen in their locality. But what really I think makes us the best is the fact that, we try to explore all options for patients. We are not a clinic that is just going to give out pain medications, which I know are under a lot of scrutiny nowadays in the media. but we try to employ a really comprehensive program that employs not only medications, if needed, but procedures such as injections, possible neuromodulation techniques that include spinal cord stimulator placement. We do injectables from steroid injections to Botox injections for lots of different reasons, whether that be chronic migraine, spasticity reasons. We offer and educate our patients, most importantly, however, though, in lifestyle modifications and physical therapy for quality of life. And there are patients who also will and possibly need surgery to help them with their pain ailments. And we are, I believe, very good at trying all options for patients to try to keep them away from surgery. However, if indicated, we will not keep a patient from going to surgery if they need it. And we also can do EMGs and nerve conduction studies. Myself, I perform those. So if you come to Florida Pain, you can expect to be treated in a comprehensive manner, where not only are you going to get education on lifestyle management, physical therapy techniques, on medications, on possible injections and procedures, but also a thorough workup, including a thorough physical examination and thorough detailed imaging or EMG nerve conduction studies or other tests, laboratory tests that may be required. And I think that's really what sets us apart, is that we are not a one-trick pony shop. We do everything.
It's interesting. We've had patient testimonials before Dr. Esposito. We had one of his patients on, and teary-eyed testimonials at the way that the Florida Pain Institute changes lives. And I think that's the key. Changing lives is what they do here at the Florida Pain Institute. Again, Merritt Island, Vieira, downtown Melbourne, Palm Bay, Penita, and they also service the Titusville area. The telephone number, 321-784-8211. Check them out online at floridapaininstitute.net. I'll put this question out there to the both of you. What can be done to treat both acute and chronic pain?
You want to feel this or me too? I'll talk. I don't want to steal your thunder, but I think, acute and chronic pain are two different things, so we can't approach them the same way. They have to be dealt with on an individual basis, and I believe each patient also has to be dealt with on an individual basis and custom tailor their treatment regimen based on their ailments, symptoms, severity of symptoms, and how the patient responds to certain treatments. Things need to be changed sometimes. But I always say there's, if you've come to my office, you've heard me say many, many times, there are 6 ways to treat pain. And, that kind of falls under the big broad category of things that can be done. And I kind of touched on that a few minutes ago. But basically, anybody that has any type of pain symptom, whether that's your knee, your shoulder, your hip, your back, your neck, you can think of it in broad categories of treatments that are lifestyle changes, as I mentioned. So simple things that people don't realize and may not have been educated on can really change a way that that you live and how bad your pain is, and keep it from coming back. That's the big thing. We're really good at getting rid of pain. The unfortunate thing is, if you don't change your lifestyle habits and you don't follow through with the right types of exercises, your pain often can come back. And so things like, avoiding bending forward at the waist for herniated discs and sleeping flat on your back, or using contour neck pillows, or don't sit on metal chairs and wooden chairs if you've got a sacroiliitis. Things like that people just don't realize or fail to pinpoint as a pain exacerbator for them. When you start talking to patients about it, they go, Yeah, you're right. I didn't even put that two and two together. And once you realize these kinds of things and patients understand them, you can really change the way that someone deals with their pain, and they may never have to come back for all these kinds of things. That's one category right there, just lifestyle changes.
Common sense.
It is. It's common sense, but sometimes, unfortunately, you know, it's hard to realize what problems you have or what exacerbates the pain sometimes when you are in pain, because it's easier for somebody on the outside to look in than it is when you're on the inside. So lifestyle changes, therapies and exercises is the next big category, and actually today we'll hopefully be going over some of those things. Medications, of course, is there's a lot of different kinds of medications, and obviously everyone knows about opioid medications as a pain relieving thing, but we also try to employ other modalities, whether that be nerve pain medications or antidepressant medications that can help with pain as well. There are topical creams and lotions that can help. There are supplements that can help, things like turmeric root for arthritis, things like that. Fourth thing that we can do is usually injections of sorts. I don't want to put it all under there, but injectables are kind of a big category. The fifth thing that can be done is procedures and surgeries, right? And which we kind of touch upon, the spinal cord stimulator, the neuromodulation, pain pumps possibly if needed, things like that. And the sixth thing, which may not be appropriate for everyone, but in the right circumstance, consultation with psychiatry. There are a lot of evidence out there for biofeedback mechanism treatments for certain pains. And there are a lot of stressors out there that seem to also exacerbate pain. Things like diagnoses such as fibromyalgia can be actually stemming from a psychiatric disorder. Things like post-traumatic stress disorder can lead to pain. So psychiatry can be employed in the right circumstance for certain patients. What do you think? Am I missing anything?
Nope, I agree. Going back to one of your previous questions, I think what Dr. Fatou was just discussing is also what makes us the pain relief experts. Again, we're not just going to throw medications at you. You're going to come in, we're going to give you a thorough evaluation. Dr. Fatou, myself, all of our providers here at Florida Pain, we are going to try to incorporate as many treatment modalities as possible. We will teach you those lifestyle modifications. We will get you to the therapy that you need. We will medicate you if indicated. We will do whatever procedures we think are appropriate to try to get you better. We will send you to the surgeon if you need it. We're just trying to help patients feel better. Pain is a delicate topic. You walk a fine line. We want you to be enjoying the best quality of life that you possibly can.
Absolutely.
You want to, and that's why, going back to what he said, it's very individualized. What's acceptable for one patient to live at a pain level is not acceptable for another. And again, each case is individualized, and we do our best to get you to that goal so that you can have some degree of quality of life,
And that's the other thing that makes the Florida Pain Institute so special. While most places are treating just 5, we've got 6 ways to treat pain here. So that's it's an amazing organization, Florida Pain Institute. The telephone number 321-784-8211. Online, floridapaininstitute.net. Offices in Merritt Island, Vieira, downtown Melbourne, Pineda, Palm Bay, and they service the Titusville area. So, Nicole, great follow-up there. I'm going to ask you the next question. I have back issues. I have a lot of back issues, and there are probably hundreds, maybe a couple of thousand people watching this right now that are sitting at home with back pain issues. It's great when we leave the doctor's office because we're motivated. After everything that great doctors like Dr. Fatou tell us, this is what we need to do, this is how we're going to treat it. But then we get home and, it all seems overwhelming. What are some ways that we can treat our back pain at home?
So again, we would teach you lifestyle modifications. I would say that would be the main thing you can do at home. Probably lifestyle modifications and therapy. You know, you can learn what needs to be done and then take that and continue it at home. As Dr. Fatou mentioned earlier, if you do not keep up with these types of exercises, it's very difficult, you know, to keep on any type of routine. But if you don't keep up with it, unfortunately, it is likely your pain is going to return. So there's many exercises you can do at home for some of the common ailments that we see. I think we could probably demonstrate some of those today.
Yeah.
Before we do that, just talking a little about prevalence, I think you mentioned it, as many of the viewers may be suffering similar issues. If you didn't know, low back pain is one of the top reasons for both missed work days as well as doctor's visits. I think it's like in the top 3, I want to say. It's high up there with...
I've always learned it's the second most common reason
So
people
it's
go to the doctor.
definitely a very common issue. So some common ailments associated with low back pain. Dr. Fatou mentioned earlier, sacroiliitis is a common issue. Herniated disc is a common issue.
Lumbar strain, muscle strain in the back. So whether that be your quadratus lumborum muscle or gluteal strain is a common thing, muscle strain. Iliotibial band tightness, which then often leads to kind of a hip/back pain and can often cause a bursitis here on the side. So those are very common things we see, and I think we'll go into some details about those types of stretches. I did want to mention, you know, you kind of asked, you know, when they go home and it can feel overwhelming at times. I personally, if you've been to my office, as you know, will send you home with quite a few handouts so that it's not overwhelming too much anyway, that you have things to go home with, so you're not just listening to me. I actually you know, print out illustrated pictures of exercises to do. I will exemplify those stretches usually to the patient in the room before they leave as well. And you know, we try to follow up with our patients to make sure that they're doing those exercises. Whenever I see them back in the clinic or for a procedure, I ask them, have you been doing your exercise? Show me how you've been doing them. So you got to do your homework, or I'm going to quiz you on it, and you might fail. So you better do your homework.
That's the beauty of the Florida Pain Institute, the follow up, the care, the making you feel like that you're part of the family, because it is one big family at the Florida Pain Institute. And again, stop and think about somebody you know in your life for a year that's never complained about not having a bad back. So with that, let's have Nicole show us a couple of simple exercises we can do at home. Okay, so we're talking about some simple exercises that you can do at home to help us out. Nicole and Dr. Fatou here. Nicole's gonna demonstrate a couple of them, and Dr. Fatou's gonna tell us what's going on as Nicole shows us the proper technique. So go ahead, Nicole.
Okay.
So as we mentioned, there's some common things that we see often. Herniated disc is a very, very common ailment. It happens usually in the younger population, anywhere from the ages of 25 to 55, but it can happen in younger patients. I've had a 16-year-old patient here that we treated, and we have, 60-plus-year-old patients here that we treat with these types of ailments. So it's not uncommon. The main thing that will make your back worse with a herniated disc is bending forward. So what I try to teach patients in doing the therapies is, it's common sense. If bending forward hurts you, then bending backwards is what you need to be doing. So most of your exercise should be focused on arching your back exercises. This is the one exercise that I think helps probably the most. What she's doing is putting her hands up flat against the wall. She's standing up like that. And then she's arching her back, and with each time that she kicks her leg back, her using her leg kind of as a counterweight so that it thrusts her waist forward. And by thrusting the waist forward like that with the arching the back technique, you can actually hopefully get that disc that popped out of place to pop back into place. And that's the goal.
That's so simple, even I can do that one. What's next?
Next we
can talk about iliotibial band problems. So the iliotibial band is this band of muscular ligamentous fiber at the top piece of the muscle called the tensor fascia lata. Now we're just being fancy. We sometimes call it the TFL. This muscle often helps you abduct or take your leg outwards. So if that's what it usually does, guess what the stretching exercise is? The opposite direction. So we're going to bring it in towards that way. She's going to pull her elbow and use her elbow to push her knee back away, which then stretches this iliotibial band. Here at the side here, underneath the iliotibial band, we have something called a greater trochanteric bursa. I know many of you have heard of the word bursitis before. And this is one of the most common places to have a bursitis. You can have bursitis in many different areas, but usually when people are talking about hip bursitis, this is the guy they're talking about. And this little exercise right here is perfect for stretching that IT band, which usually rubs against that bursa, which is why you get the bursitis in the first place. So if we can do these exercises, maybe with some topical cream agents, and maybe an injection to reduce all that inflammation, and you do the stretching, we can fix it totally so that it doesn't come back ever again. And it needs to be a multimodality approach.
Fantastic. And we are here at the Florida Pain Institute. We're at a new location today. We're in the downtown Melbourne location. There are 5 locations: Merritt Island, Palm Bay, Vieira, downtown Melbourne, Pineda, and they service the Titusville area. 321-784-8211 is the centralized number, FloridaPainInstitute.net. We're here with Dr. Kamal Fatou and Nicole Malerba, nurse practitioner here at Florida Pain Institute, going over some exercises that we can do at home. How about one more for the audience at home? Show us one more.
Do SI or quad?
Well, I was going to show you 2 more. But
Oh,
okay.
2 more is good.
Okay. Well, another common one is sacroiliitis. See, people come in and say, my hip hurts. In reality, hip pain would cause groin pain here in the front. But back here, we have another joint. It's called the sacroiliac joint, or SI joint, some people say. And so a simple exercise for this is doing the opposite of what hurts. What should hurt with sacroiliitis is going outwards. So guess what the stretch is? It's the opposite. What you want to do is lift up the knee up, and then you'll use the opposite hand to pull across. And you don't want to twist your body too much because you want the pull to actually open up that SI joint and give you the stretch that you're looking for. And you want to hold that stretch for about how long?
30 seconds.
30 seconds. Opposite hand and across the knee. No, you're doing it. You're good. All right. And just like that.
Should these exercises, when should we be doing these exercises? In the morning, or should we be doing them several times a day?
Exactly. Several times a day. So usually with sacroiliitis, one of the lifestyle modifications that I give you, well, there's 2 main ones. The main one that I would say is don't sit on hard surfaces. Remember I mentioned that earlier. Sacroiliitis always gets worse when you sit on metal chairs, folding chairs,
Right.
park benches, the church pews.
Or
You should
long
always
periods.
or you sit for long periods of time. So what I usually say is don't sit for greater than 50 minutes, 50 minutes out of an hour. Every 10 minutes out of that hour, you should be getting up and stretching or performing this stretch, which for people who work during the day, this is such a simple stretch. You can do it sitting at your desk while you're in front of the computer. Nobody's going to bother you. Every once an hour, you do the stretches, and that can really, really help you. So these are very simple techniques. I'm trying to teach you things that you can do on your own anytime.
Does that 50 minutes go for people that drive for a living as well?
So that is true. With sacroiliitis, oftentimes I have to tell patients if you go on a road trip that's 2-3 hours long, you have to stop a couple times on the way. Guys have a hard time with that. Women usually are more okay with it. But generally speaking, patients who have sacroiliitis usually listen because it hurts.
Yeah.
And so if you follow through with these simple rules, and we use the seat cushion, you don't sit for too long, you avoid hard surfaces, you do the stretching exercise, maybe you get sacroiliac joint injection and take turmeric root as an anti-inflammatory, or Advil even, you may do very, very well, and this
You
will
should
never
improve.
come.
Well, these have been great. Now for our bonus exercise.
Yes, so another common ailment that we see is lumbar strain. That often happens after a bad night. Maybe you slept funny on it. That's not uncommon. We hear that all the time. And then around here, what we hear a lot about is the golfers, the funny swing. Maybe you took a funny swing, or you hit a divot, or you hit something like that, and then I strained my back. So that's not uncommon. That's not your spine itself. It's not a disc problem. It's not a nerve problem. It's not a joint problem, but it's the muscle itself. And so what we usually can do is employ very conservative treatments to usually get that. Sometimes they require trigger point injections or something like that, the old school cortisone injections into the muscle, which we can just do in the clinic visit. It doesn't need to be in a big procedure suite or anything like that. But oftentimes physical therapy, maybe some topical compound cream and maybe some anti-inflammatory drugs may get rid of it on its own. So one such exercise that we'd like to employ, this is for lower back strain. If we want to stretch the left side, we will put the right foot in front of the left foot, put the right hand on the right hip, and stretch that left side by pulling all the way over. And you can really feel that stretch. These stretches should be held for about 30 seconds at a time. They should be repeated in 5 sets. And if you can do that 2 times a day, once in the morning and once in the afternoon, that's really the employment that we would use. And it works really well. Yeah. And we there's another way to do these exercises actually that I have on my handout that it can be done in the chair. So if you feel like your balance is an issue or something like that, they can be done in the chair. Or you could even use the chair itself as you're standing as your balance. So you can still do the stretch like this so that you don't feel like you're going to fall over.
In other words, there are no excuses should
No
you want to feel better, right?
No
Yes.
excuses.
Fantastic. What a great time here today at Florida Pain, meeting with Dr. Kamal Fatou and nurse practitioner Nicole Malerba. Again, remember, the Florida Pain Institute with 6 locations here: Merritt Island, Palm Bay, Vieira, Pineda, downtown Melbourne, and servicing the Titusville area. And the good news is there is one centralized number for all of those locations: 321-784-8211. Dr. Fatou, Nicole Malerba, thank you both so very much for spending time with us here on Space Coast Daily Health Spotlight. For Dr. Fatou, for Nicole Malerba, I'm Alan Slaughter-Zinsky for Space Coast Daily TV.
Thank you.
Thank you. Come see us.